All right, let's dive right into some fast-paced med math. Mastering this is absolutely critical.
First up, let's talk about why this is so important. The stakes here, they're incredibly high. Get this, medication errors cost the healthcare system over $21 billion every single year. And way more importantly, these mistakes affect about 7 million patients every single year.
This is why your program probably demands a perfect score. Your goal is 100% accuracy. Let's get you there.
Okay, so it all starts with the basics, mastering the metric system for healthcare. We're going to focus on grams, milligrams, and micrograms. You have to know how they relate. Just remember this order. Grams are the big guys. Micrograms are the smallest of the three.
So, the big question is, how do you jump between these units, fast and without mistakes?
I'm going to show you two super simple ways to do any conversion. It's a game changer. You can either multiply or divide by 1,000, or just slide that decimal point over. Okay, let's try moving the decimal. We'll convert 1 gram to milligrams. Simple. So just picture a decimal right after the 1. We're going to a smaller unit, so we move right.
Slide it 3 spots to the right, fill in with zeros, and boom, 1,000 milligrams.
See? Easy. Now that you've got conversions down, let's plug it into the formula. This is your best friend, the desired over-have formula. It tells you exactly what to give. Let's break it down. D is what you desire, H is what you have, Q is the quantity. Okay, this is the golden rule, you guys. The units for desired and have must match. All right, let's put it all together now and see how this works in the real world. Step 1 is to just identify what's going on. We see the order is in grams, but we have milligrams. So, step 2, we convert. Remember how? Move that decimal 3 spots right. 0.25 grams becomes 250 milligrams. Now we just plug it all into our formula. Desired is 250, have is 125, quantity is 1. Do the quick math, and there it is. Your answer is 2 tablets. Look, this is so much more than a math test. It's about patient safety, and now you're ready.